Good evening, everyone. I am Jennifer Bowles, one of the clinical pharmacists at North Oaks Medical Center. I work on the antimicrobial stewardship team, which reviews the majority of the antibiotic use in the hospital. This week is Antibiotic Awareness Week, and I'm here to talk a little bit about antibiotic resistance. What antibiotic resistance is when we expose ourselves to multiple antibiotics or overuse them, misuse them. Patients can become resistant if you take multiple antibiotics over a period of time. What happens is bacteria kind of become smarter than we are sometimes, and they develop resistance. They change to where the antibiotic doesn't work effectively anymore. So what can happen is you could potentially have to go to the doctor more, or you could have to stay in the hospital longer. And the problem is you could be exposed to toxic effects of medications that may or may not be appropriate. So it's really important that you communicate with your healthcare providers as well as pharmacists or anyone if you think you may not need an antibiotic or not. It's always a good conversation to have with your providers. There are over 30% prescribed antibiotics in the United States that are deemed inappropriate per a study a few years ago. So that's kind of why this is a very important message that everyone understands. And even the most important thing is sometimes these resistant bacteria can even cause death. So we really need to be aware that this is a world health problem, not just the United States. But that's pretty much all I wanted to say, kind of an intro. But if anyone were to have any questions, we can go ahead and start.
Okay. What are some things people should know about antibiotics?
So the first question is, what are some things people should know about antibiotics? Well, one thing is antibiotics only cover bacteria. So if you have a bacterial infection, most sore throats don't even require antibiotics, which leads into the fact that you may have a viral infection like the flu. And the typical treatment for the flu is just treating all the symptoms you may have. So, you may go to your local pharmacy and ask for, if you have a cough, maybe they can, recommend a cough syrup. Or a humidifier may be appropriate. Or you can talk to your other healthcare providers and they can assist as well. So it's really important to not take an antibiotic when you do have a viral infection, because it's not really going to make you feel any better. It's actually probably going to cause more antibiotic resistance, which is the main point of today.
When somebody has green colored mucus, isn't that a sign of infection?
Second question is, when someone has green mucus, is that a sign of infection? No, it is actually a sign that your immune system is working on whatever infection or particular situation that's going on in your body, and your mucus can often change colors.
Are there any complications when taking antibiotics?
Question number 3 is pretty important, is are there any complications when you're taking antibiotics? All medications have side effects, and I can't stress that enough, but antibiotics can cause something as simple as an upset stomach or a very serious allergic reaction that might even bring you to the emergency room. About 1 in 5 emergency room visits are due to complications of antibiotics per some independent studies. So if you don't need it, basically my message is don't take any.
So what is the treatment if you do get an infection that is resistant to antibiotics?
So the next question is treatment for if you do get a multidrug resistant infection. It would entail maybe multiple antibiotics at one particular point in time, also a longer course, and your physician or nurse practitioner may have to get a little creative and use more than one drug, which is again exposing you to something that is potentially toxic to your body, and it can require multiple trips. You could also be sent to an infectious disease specialist. Like at North Oaks, we have Dr. Newman, so it might require her or any other provider to be under your care.
Do probiotics help to reduce antibiotic resistance?
Probiotics, that's an interesting debate recently. There are some studies that say yes, they can help with certain resistance that can happen. Typically, a probiotic kind of restores your normal flora in your gut, so it doesn't necessarily help with resistance, but there are certain diarrhea that can be associated with resistance. It's called Clostridium difficile, or C. diff, and some reports say yes, take a probiotic in certain instances, so you would always want to check with your healthcare provider if it's appropriate for you.
What's the best thing to do if you are being prescribed antibiotics as a precaution?
The best thing to do if you're prescribed antibiotics as a precaution is another question, is to really ask, well, what's the precaution? Why would you unnecessarily, expose someone to an antibiotic? It would require, in case, maybe the physician says, well, maybe this is a viral infection, but I'm going to give you these antibiotics in case. Well, sometimes they may delay that a couple days, that if you're not feeling better, go ahead and take antibiotics. So that's always something that you would want to discuss.
Do you really have to take the antibiotics for the entire time that they're prescribed?
Another question is, do you really have to take the antibiotics for the time they are prescribed? Yes, that's back to antibiotic resistance. And what plays a factor is you have to be given the right antibiotic, the right dosage, and the right duration. It's very important to do what's directed on your prescription bottles. You may get a phone call from your doctor or a nurse practitioner saying, hey, I don't think you need 10 days, let's do 7 days. But otherwise, you don't want to save it around, you don't want to keep it for later in case you get sick again, or give it to a neighbor. That's probably not the best solution.
So if you can develop antibiotic resistance, why do we even give antibiotics?
That's a good question. If you can develop antibiotic resistance, why give antibiotics? There are a lot of infections that unfortunately do require an antibiotic treatment. Like, say, if you have community-acquired pneumonia, there is a proper course of antibiotics that will help along with your immune system to cure the infection. So when you have an active bacterial infection, antibiotics are appropriate.
So if you have an infection that does not require antibiotics, what's the best treatment to take?
If you have an infection that does not require antibiotics, you would treat the symptoms, basically. Like I said, if it's a viral infection, like if it's a cold or a flu, you're not going to feel better right away, unfortunately. You're just going to have to kind of wait it out. Some of these symptoms can last a week to 2 weeks. If that's all for now, I appreciate everyone listening and joining us today. If you would like further information, there is a website. It is on the CDC's website. It's www.cdc.org/getsmart. It has information for our healthcare providers as well as our patients. Thank you all.